afternoon, everyone. My name's James Thornton. I'm Senior Communications Manager at the Healthy London Partnership. Welcome to this afternoon's webinar, Enhanced Health in Care Homes, London Winter Readiness, session for commissioners. And I suppose when we're talking about social care today, we're talking about in the context even of social care providers. So about social care providers for commissioners. If we do have a session on Wednesday as well for care home providers, so do join that if we've got any care home provider colleagues on the call today. There's a lot to get through today, as you can imagine, and so I'm going to make this very, very quick. So let's make sure everyone's on mute, please. Please turn off your cameras, unless you are presenting, of course. As I say, we're recording, so please be aware of that with any questions you're asking, but that does mean tomorrow we should be able to share the link with you, and you can go back to any slides you may have missed or want to look at in more detail. At the same time, we'll be sharing the slide pack as well. So again, don't worry too much if the speakers have to get through quite a lot of content quite quickly today, because it'll all be there for you to see afterwards. I'm going to hand over very shortly to Bryony Sloper, who's the out of hospital cell lead. And I think the last thing I'll say before handing over is we will be doing Q&A at the end. It should be about a quarter of an hour, but please do add any questions into the chat box as we go along. I'll be coming back online on camera then to kind of go through those. Any questions we can't answer today, we will come back to you as well directly. So without any further ado, I shall hand over to Bryony. Over to you, Bryony.
Thank you very much, James, and welcome everybody to this webinar. So next slide, thank you. So as James said, my name is Bryony Sloper and I'm the cell lead for out of hospital services, specifically ageing well, community services and length of stay and discharge pathways. So the purpose of this webinar, we've had a really collective approach to planning this winter jointly with health and social care, and wanted to share those joined up resources, make sure they were highlighted to you, and ask you as commissioners to focus on specific areas relating to flu, relating to workforce, relating to capacity tracker, digital and care home resources. So those are the key areas and to keep an eye out for. And next slide, James. So in terms of what we're covering today, we're going to give a brief overview of the Enhanced Health and Care Home Framework and the London regional approach. Then we're going to spend more time on flu, the flu outbreak management, standard operating procedure and the vaccination campaign. Then we'll look at prevention and resources available, particular focus on clinical support for care homes, and then finally sharing some good practice, and we'll have a Q&A, as James said, hopefully about 15 minutes or so. There are a lot of speakers and a lot of materials to cover. So after I finish my section, each speaker will then introduce themselves as they come onto their own content. Next slide, James. So to provide you with some high-level information in terms of the Enhanced Health and Care Homes Framework. Next slide. Thank you. So I'm sure you are all very familiar with the EHCH framework and the updates that were issued in March this year. So highlighted in red, there are the additional elements or the areas that were asked to have a more detailed focus. And again, don't worry, all of the slides will be made available to you because there's a lot of detail on them. Next slide, James. But of course, COVID changed all of our plans. So in terms of our immediate priorities, we've switched to the rapid rollout of NHS Mail, the rollout and implementation of capacity tracker across all care home providers across the region. A particular focus on how we recognise hypoxia in the elderly and the delivery of pulse oximeters and guidance on recognising hypoxia and what to do. And digital became a huge priority, so we've got a core section on digital. Going forwards, in terms of the national priorities and those changes, making sure that we are supporting and mobilising the weekly care home rounds is absolutely essential, and we've got some information on that. Also, recognising the deteriorating patient early and in terms of how to access support. There's a particular programme of work around foundation dentists and oral health, and we're working very closely with the academic health science networks and looking at patient safety and quality improvement. Next slide. And particularly, again, you'll all be very familiar with the DES and how it relates to flu prevention. So we'll be focusing on the contents and the requirements that contains in order to provide the maximum amount of support to care homes, providers, residents and staff. Next slide, James. And I just wanted to make sure that people were aware of the governance around care homes across the region. So very shortly into the pandemic, we set up a specific regional care home oversight group. It was really important. This included a whole range of partners, and it's jointly chaired by health and social care. It's linked into the two big national cells, but it covers a whole range of different programmes of work. It meets very regularly. We've got providers, PHE, CQC, all sorts of partners on that. As well as looking at the Enhanced Health and Care Home framework, there were key areas identified through after action reviews, provider feedback around data and how we have oversight of data to understand variance, particularly resources and how we collated resources into a single place for providers to be able to access the most up-to-date Londonised version of the national guidance. Best practice in discharge to support safe discharges from hospital into care homes, relatives and residents' voice, so particularly around wellbeing, and digital. And as I say, we'll come on to digital in quite a bit more detail throughout the webinar. Next slide, James. So with that, I shall turn off my video and hand you over to colleagues who will introduce themselves as we go. Thank you.
Hi, I'm Ezra Kanyimo, and I'm the EHCH lead for London. So on this part, we're just going to go through the standard operating procedure that you will get a copy of. We're just getting it approved this week, so you should be able to get it fairly soon. So it will cover a few things around the management of outbreaks, and to include roles for care home staff and managers, the registered GPs, out-of-hour GP services, and the IUC teams. We also include the health protection teams and the CCGs and community providers. Some of you already know that this SOP came about because of the several outbreaks that happened in 2017, 2018. So this SOP is not new, but it's just an extension since 2017, 2018. And this year, there is a couple of additions because of the COVID-19. Next slide, please. So in the SOP, you will find that we are defining COVID and influenza at the same time. And we know that COVID and influenza can occur at the same time. And we know that the presentation is similar. And we also know that the vaccine in terms of the flu should be given to reduce the likelihood of co-infection, to manage the burden of influenza on health services. And one of the things we wanted to point out to you guys is we know that care homes can be vulnerable to both viruses. We already know how difficult and challenging COVID has been, but we also know that influenza can equally be challenging. Next slide, please. In the SOP, we have spoken a lot about testing and the importance of that, because that will help determine whether an outbreak.
Ezra, you've just popped yourself on mute there by the looks of things. Just bear with us, delegates, at the moment. I think Ezra's having a few problems with his sound, so.
And Ezra can't join us.
Sorry.
Oh.
I'll start again. So I was just saying, the SOP talks about the testing element, and the testing will be determined whether an outbreak is due to seasonal flu or COVID, which will help with things like administration of Tamiflu, either to treat or to use as a prophylaxis. Our resource pack, for those that don't already know it, will also help in terms of how people should be contacting their local health protection teams and how Public Health England can help. And there'll be also things like tips on how to swab residents, how to assess capacity. And when you look at the pack, you'll be able to pick up on those. Next slide, please. I'm not going to spend too much time on this, but this is a process flow which will help the management of outbreak of either flu, influenza, or COVID. And what you can see is it will start by contacting the local GP or going via star lines, which I think care homes will be familiar with. But the slight change in this process flow is the stage 4, where the health protection team, we will wait for the confirmed results. And once the results have been confirmed, then they will make a decision whether you will go through processes 5 to 10, which is the process for influenza, or follow the usual process we've been following for COVID. Next slide, please. We know that outbreaks are a challenge at the moment, and one of the key things that the SOP encourages care homes to do will be to create a list, to have additional lists for residents who potentially require an antiviral, and how they should send information to health protection teams. These things will just help care homes to be able to move quite quickly, so that and also the people who are supporting the care homes will be able to know what's required to support that particular care home, especially when you're clear around the lists and the numbers of people who might be impacted by the outbreak. Next slide, please. One of the things which is a hot topic is, with outbreaks, visiting gets impacted. So in our resource spec, we've tried to talk a little bit around visiting. And I think the key thing to point out on here is how we're encouraging care homes to be able to speak with local authority commissioning team. And we're being made aware that in some local authorities, there might be decisions made by the directors of public health in terms of either visiting being stopped or being continued. So I think it's something that we would like you guys to be aware of, that while you're managing outbreaks, you also need to be aware of how are you also managing and enabling visiting. Next slide, please. Record keeping is important. When you do all that, everything that we're doing around managing of outbreaks. So this slide just reminds people on the importance of record keeping, and making sure that if there's anything people need to follow up, people can follow that up easily without having to start from scratch. Next slide. Thank you.
Wonderful. I'll hand over to Catherine now. Catherine, if you're able to introduce yourself.
Hi everybody. My name's Dr. Catherine Heffernan, and I'm a public health consultant, but for the last 7.5 years now, I've been the principal advisor for commissioning early years, immunisation, vaccination services. So I advise NHS England on how they commission the Section 7A immunisation programmes. So I'm just going to give you a few bits and pieces here on flu vaccination and why it's important, and particularly this year in light of the COVID-19 pandemic. So flu affects up to 15% of the worldwide population every year. And like COVID-19, it causes a mild illness in the majority of people, but it can actually cause severe complications like pneumonia and death in a proportion of our population. And every year, flu kills 11,000 people. Care homes are disproportionately affected because you have very vulnerable people within your care homes who are susceptible to the consequences of flu. And anyone can contract flu, and being healthy does not protect against infection, very similar to what we're learning from COVID-19. And flu spreads faster than COVID-19, which is something to bear in mind too. Those who are at very high risk of developing complications, you can result in deterioration of the chronic condition, hospitalisation, and as I mentioned before, death. So we do have very much agreed at-risk groups, particularly those who are over the age of 65. They're very susceptible to influenza, in particular to the strain H3N2, which comes to prominence quite often in flu seasons, and it does produce a lot of hospitalizations and deaths in our over 65s. People with long-term medical conditions, there's about 10 groups of people. It includes asthma, diabetes, heart disease, but also chronic kidney disease, chronic respiratory disease, obesity, learning disabilities. So there's quite a big group. Pregnant women are particularly susceptible to flu, not just to the main A strains like the H3N2, but they're very susceptible to the B strains, which tend to be quite milder. And for many of us, it's just like getting a cold, but it can bring about the loss of a baby, or it can bring about low birth weight, or the pregnant woman herself can be very, very sick and require hospitalization. It's really, really crucial that our at-risk groups every year do get their annual vaccination. It's not given for herd immunity, it is given for individual protection. Very, very important that they do, because they're very susceptible to be severely affected by the consequences of flu, very similar to COVID-19. We do very much promote flu vaccination in our healthcare workers and our social care workers. You might say to yourself, oh, I'm healthy, when I get flu, I recover, or I never get flu. But actually, you're working with these very vulnerable people. And it's really, really important that we vaccinate ourselves, because we're looking after these vulnerable people. But also, we don't want to help spread the infection across our care homes. And by us being vaccinated, we can actually interrupt the spread, and we can even prevent flu from ever reaching the care home. So how does the flu vaccine work? Well, the flu vaccine basically mimics what it'd be like to get an infection, but of course you don't get any of the nasty consequences. So it exposes your body to a tiny bit of the virus, and your body then will produce its immune response, and then you'll have some memory. So if you are then faced with the actual virus, you have protection and you're protected against it. So instead of suffering the natural virus infection, you bring about the same immune and memory responses without having to suffer the infection. The influenza vaccine has been shown to reduce the chance of getting flu in trials where they've used healthy adults by 70 to 90%. So it's a very, very good way of protecting our population against flu. So why should I be vaccinated? Well, I've already mentioned that it is our duty as people who look after others to protect the vulnerable and to do our bit. And care homes are predominantly affected every flu season with outbreaks due to influenza. And you can see there that around 70% of our outbreaks last year were in care homes, and less than a third of the eligible care home staff were vaccinated for flu last winter. So if we'd vaccinated nearly all of them, or at least 70 to 75%, we would not be seeing this number of outbreaks, and we would not be seeing the high rates of hospitalisation and ill patients and deaths, sadly, from flu. So this year, the flu vaccination is more important than ever. For this winter, we're going to have a co-circulation of flu alongside COVID-19. We do not know what that really means. We do not know what the co-circulation will mean. We do not know if you were infected by COVID-19 and then get flu, will it make flu worse, or vice versa. We have very, very little information. The Southern Hemisphere are only just finishing their winter season. We have very little information on what that means. We are about to go into a second wave of COVID-19. There's little we can do about COVID-19. We've got our sanctions that we can do, but we have no vaccine yet. We have no real effective treatments yet, which we do have for flu. We have a vaccine and there are treatments there for flu. So really, by vaccinating with flu, we can greatly reduce the burden on our health services this year from flu, so that our health services can cope with COVID-19. So we really do need to make our duty, not just to protect ourselves from flu, but we need to do our duty this year to reduce the burden on our health services and our care services so that they can focus on COVID-19. Flu is something we can do something about, and we really should do that. And as it says down here, the flu vaccine can be seen as PPE. It is, it's part of our armoury against COVID-19. Next slide, please. So yes, there's people are always asking this. There's lots and lots of myths or really, really silly things that get circulated, and people will Google things and they will come up with all sorts of things. The flu vaccination is very safe. The flu vaccination that is given to adults is inactivated. There is nothing live in it. You hear people who say, oh, I've had the vaccine and I've got the flu. No, you haven't. One, you might very well get a bit of a temperature after you have the flu vaccine. You might have a bit of a sore arm. But you might feel a little bit kind of sniffly, but it goes away and it's very short. It's not the flu. Other people have said, oh, I got the vaccine and then I got the flu. It can take up to 14 days for the flu vaccine to actually take an effect. So it is quite possible that you are exposed to flu and you develop flu. However, you then have the vaccine and it actually makes the symptoms less. So again, there's another rumor that goes around, well, it's not a rumor really, but sometimes the vaccine, it only protects you against the 4 main strains. We sometimes get some rogue strains out there. And yes, the vaccine may not be a great match. It doesn't mean that you shouldn't have it. By having the vaccine, you're protecting yourself against the 4 main strains, but also if you are exposed to another new strain of flu or a novel strain of flu, you will get protection from the vaccine and your symptoms will be far lessened if you're exposed to flu.
Hi, Catherine, just giving you a 2-minute warning.
Okay, thank you, no problem. So our targets this year is we do need 75% uptake across all our care home residents, and we need 100% uptake in our care home staff. We offer for non-healthcare workers in care homes like cleaners, etc. They are entitled to a free flu vaccine from our pharmacists. I can move on to the next slide now if you want. So what I really, really want from everybody out there is that every care home should really have somebody who's dedicated to flu vaccination, who knows how many staff are there, who knows how many residents are, and who can keep track of who's been vaccinated and to promote it. So very similar to what we have in our acute trusts, and really having that action on the ground and that sort of ownership and promotion is really, really important, because this flu season is really, really vital, particularly because we're in a pandemic, that we do have the best uptake we possibly can. And this is working with us across London. So you're entitled to your flu vaccine from your GP. If you're a non-healthcare or social care worker, you're entitled and you're working in care home, you're entitled to it from your pharmacy. Please liaise with your local PCN to arrange for the vaccination of all residents and staff. We can equally also work with you if needs be. There are some pharmacists who are able to come in and do some pop-up clinics and do both as well. But this is really, working with your local PCNs to make sure that this happens. At the bottom there, you've got a web link, myvaccinations.co.uk. That will bring you through to the pharmacists across London who are offering the flu vaccination. So if you're not able to have it in your care home or able to go to your GP, you can find out who's your nearest pharmacist and pop in and have your vaccination there. And now this is, as I mentioned, it's really important that we know, particularly too, if there is an outbreak in your care home, the first thing you will be asked is about flu vaccinations. So let's preempt that. Let's have some way of tracking how many people have been vaccinated and how well we're doing. This is a very good example from South West England. We've never had something like this in London, but it's actually really, really crucial, because we can preempt and we can prevent outbreaks in care homes, and we can be on top of it this year. So I would be really open to work with people across the system in having some sort of a regular reporting system. It would be fantastic if we could finally crack this for London. Next slide. This is about risk assessments. Oh yeah, this is just to point out that because of the COVID-19, practices are delivering differently across London. So just bear in mind that when you're making appointments, there might be fewer appointments. So do plan in advance when you want to get this. There is also a very useful webinar there, Care Provider Workforce Risk Assessments, and that has some case studies there showing how participants, how they've used the Workforce Risk Assessment Checklist. And you can watch this for free, and it's a very good webinar resource. Thank you.
Thanks, Catherine.
Thank you.
Bridie.
No problem. Jane, handing over, if you just introduce yourself, that's great.
Yeah, sorry about that. So hi, I'm Jane. I am part of the out of hospital cell, and we're just going to run you through some of the resources. So obviously we are very, very tight for time, so we're not going to be able to cover everything. So what we try to do is bring out some of the things that we think may be slightly different from our usual conversations that can help. But if not, remember that we have the resource pack. Keep adding questions. It's nice to see those kind of like coming through. Next slide. So everything was planned. We had everything sorted out, and then obviously for a lot of us, the drop on Friday evening for the winter plans has affected that. So what we wanted to just kind of like to highlight is there's a link to the paper there. It outlines expectations for national, NHS and local authority action alongside the ask from providers. We have put that into a table, so if you would like that, if you can pop your email address into the chat, we can send that across to you. But it focuses on preventing and controlling the spread of infections in care settings, managing staff movement, PPE, testing and the flu vaccination, so no huge surprises there. I think what's also quite nice is it outlines an expectations for a number of the enablers. So yeah, it's worth just kind of like having a look at those to see what kind of like comes through. And these are just the asks from providers. We won't go through this, but again, it just kind of like allows you to kind of like just to double check that this is aligned with what you're already asking providers to do, and you can reinforce things that will help them over the next couple of months. Next slide. So as mentioned earlier, we have the Care Home Resource Pack, which has a lot of information in there. So there's a lot more detail in that pack. So I would recommend having a look at that and using that locally. And I think there is some really positive feedback, but we will always welcome more feedback. So if you have got anything, please do let us know. Next slide. So Ezra's going to present this one.
Yeah, so I think we just wanted to highlight PPE and infection prevention and control. And with the latest guidance, I think most of you will be aware that there will be free PPE, which was recommended in the guidance that will be given to care homes until 2021. So we just wanted to highlight that to you guys. And also along care providers, along with others, that they can register for that through the relevant websites. Another thing to highlight was there was a comment around organization being able to agree joint mechanisms for enabling staff to raise concerns about access to adequate supplies of PPE. So just wanted to make sure you're aware of that. The other thing is, it goes without saying that hand hygiene is cornerstone of IPC. I'm not going to teach you guys how to suck eggs, but I just wanted to highlight the importance of PPE, wearing mask, and social distancing. Next slide. This is just to highlight how you guys can also support your care homes by filling in this poster to enable them if they were concerned about residents, and just being able to have clear contact numbers to sort of say this is who you need to speak to if you were stuck. So this is just a slide to help you with that. Next slide. I think I'll hand over to Chris, I believe.
Hi, can you hear me?
Yeah, you're all good, Chris.
Wonderful, thanks. So hi, my name's Chris Larkin. I work in the NHS London out of hospital cell, and I've been supporting the rollout of Capacity Tracker in London. So Capacity Tracker is a secure online tool which has been mandated nationally since April of this year as the single way for care homes to report on key operational information during the COVID-19 outbreak response period. The data the care homes report through Capacity Tracker includes things like number of beds and vacancies, how many staff they have, their PPE supply, suspected and confirmed cases of COVID among residents and staff, as well as things like how well they've been able to implement infection prevention and control measures, and whether they've had good access to COVID testing and clinical support. So the information that care homes input into Capacity Tracker is available to CCG and local authority commissioners, as well as regional and national NHS colleagues and the Department of Health and Social Care. And it allows commissioners to understand the challenges that providers are experiencing and support them with the right resources in the right place at the right time. Care homes which update Capacity Tracker on an ongoing basis are eligible for financial support from the Infection Control Fund, and the government announced last week that that's been extended through to the end of winter. There's more information on Capacity Tracker available by clicking on the links on this slide, or by contacting the regional leads who are in the sort of middle left box on here. And the slide after also contains a sort of diagram of the regional governance around Capacity Tracker for information only. Thank you.
Okay, can we go to the next slide, please? Okay, so the next slide is just covering CHC. So we all know that CHC has been reintroduced. I'm not going to really cover what the restart kind of like plans are, but it's mainly just to kind of like reinforce that there's a lot of the digital enablers that will be the kind of like the focus. So from Karen Scarsbrook, and if you do need any further details, we can link in with her. But basically kind of like the message is we need to be working with our care homes so that they are feeling confident to cooperate for virtual assessments, new ways of working, and that we can use kind of like the existing local approaches that you've brought in using NHS Mail and Microsoft Teams to actually support them to feel part of this process right from the beginning. If you do have any kind of like ideas on what is working well with your care homes, it would be great if you did pop them into the chat, because I think the more we hear about what's working well, we can just reinforce that and share that with other areas. Next slide, please. Handing over to Alice now to talk about NHS Mail.
Hi, I'm Alice Green and I work for the London Out of Hospital cell. So just to go over NHS Mail, so it's already started to improve communication between health and social care, and its values become even more evident during COVID, particularly with reduction in face-to-face contacts. So care providers have been using NHS Mail with a variety of healthcare professionals, so pharmacists around prescriptions, GPs sending photos in of any issues they've seen and being able to communicate that way, allied healthcare professionals, families, CCGs and local authorities, and hospitals, so around discharge plans coming through email. Next slide, please. So sharing best practice across London has shown kind of real benefit in demonstrating how NHS Mail can be used most effectively. So we've got some really great case studies from across London. So there's a few here to draw your attention to. So a case study around a care home in Hillingdon, how they've used it and what it was like before NHS Mail. And then down the right hand side is how CCGs have started to help their care providers in their areas to think of other ways that they can start to communicate in different ways. So Hillingdon CCG, through the medicines management, they have a copy of all secure emails for care homes. They can start to share information through that. Enfield, again, pharmacists using NHS Mail to securely send prescriptions, and Tower Hamlets doing some really interesting work around Teams. Next slide, please. So this slide is just a really quick recap of the fast track service, which is still going on for sign up to NHS Mail. So I think we're around 80% now sign up across London for care homes, and about 30% for domiciliary care. So it's just still completing the simple form, sending it to our NHS Mail request email, and then activating their account. That is the bit that we're really focused on at the moment. Our activation rates are around 50 to 60%. So we just need to remind care providers that once they do get their new email accounts through, they activate it and start using it as quickly as possible. And there's also just some ideas around how to get going quickly once care homes have got their email accounts. So some really simple ideas that they can start with. And then down the bottom is around what having an NHS Mail account will help with other digital initiatives in the future.
Thank you, Alice. 1 minute, if that's all right.
Just hand over to Jane for the DSPT slide.
Thanks, Alice. So I suppose the final message on this one, it's been amazing, the uptake with NHS Mail, and to allow that, there was a waiver of the data security and protection toolkit. They are extending that kind of like waiver, but are asking that providers register on the data security and protection toolkit ahead of September. We know that's going to be a big ask, but if you can help us to share that message, it doesn't mean that things are going to be taken away at the end of September, but it just allows us to know how many care providers will need support to complete the DSPT next year. So if you follow this process through, there's loads more information on digital social care, but for any of the digital work, if you wanted to drop me an email, I've popped it on there, so jane.sproat@nhs.net, and we can answer those questions. We can also get a list of those updated email addresses. If local leads can get in touch with us, we can support that. It is a bit manual, so bear with us, but we'll happily try and help.
Brilliant, thank you. And our final section, I'll hand back to Ezra to talk about clinical support for care homes. Again, all of the slides will be shared, so if you're missing detail, it will all come out to you individually. So Ezra, over to yourself.
Thank you, Bryony. I'm not going to labor too much on this one. This information, some of this information is already in our resource spec, but we just wanted to highlight that for all of the things we've talked about to happen, there is some support which is happening in the background, including community services and primary care. And also there's some work around pharmacy and medicines, which is quite key to what we need to do. Next slide, please. This is just highlighting again from the DES perspective how they are supporting the EHCH, and that's for you guys to look at for later on. Next slide. And this is just highlighting the deadlines of some of the things they have to have in place. Next slide. So the principles of alignment of care homes is each care home should have a single PCN, which is considering location, existing GP registration of patients, and existing local relationships and contracts. And the lead GP or GPs will be agreed with responsibility for EHCH service requirements for each PC aligned care home. And of course, patients should be allowed to have their choice about where they need, which GPs they need to be registered with. And ultimately, commissioners have overall responsibility for ensuring that each care home is aligned to a single PCN. Next slide, please. This just highlights the role of the care home's clinical leads. And the next slide, it will highlight the role of the lead practice in PCN. I think we just wanted to highlight to you guys that there are slight differences between those, and is just wanted to make sure you have plenty of information to support you with that. And if there's any questions, please let us know. We'll make sure we'll get answers to you from our PCN colleagues. Thank you.
Wonderful, James. I can hand over to yourself.
Thank you ever so much, Bryony, and well done, presenters. We got through an awful lot there. We had a lot of questions in, so I think, Brian, if it's okay with you, if we don't get through them all, perhaps we could put them into a kind of an FAQ type document and send them out to delegates tomorrow.
Absolutely, it's been great to see so many questions, so we can do that.
Brilliant stuff. Okay, so many that my teams won't let me scroll up, but thankfully I've written a few of these down. I think our first questioner was Vicky Nelson from South West London CCG, who was asking about where can delegates see the outputs from the regional oversight group, where do they go, and how do people raise concerns to that group? Any of our panelists pick that one up?
Yes, I'm happy to, James, as Bryony. So, Vicky, there is an ICS lead represented from each sector and representing a mixture of health and social care. So the representative for South West London is from social care. So I'll send you the specific named link, but I can, and in terms of the membership, the idea is they're representing their specific sectors, so they can feed up issues alongside provider representatives, and there's resident representatives as well. So the feedback and the actions from the regional oversight group are fed into a number of different forums, including to the DAS leads, and helps inform the fortnightly return that goes up to ministers using capacity tracker data as well. And we can have a conversation offline about that. Happy to share the terms of reference when we send out all the links following this webinar.
Great, thanks, Bryony. Second question we had was from, forgive the pronunciation, Maxine Bruniges, who was asking, any other local authorities being advised of their care homes having problems with getting a dentist for their service? And what do we think people's expectations are in terms of SLAs and service specs? I guess that was more of a question to fellow peers, but anything that any one of the panelists wanted to pick up on there at all?
Yeah, so I can pick up that. So it's definitely something that care homes, if they are having problems, they should speak to their kind of like CCG. Regionally, the domiciliary care visits are commissioned by the regional team. So if you are having problems where you cannot get somebody to a local dentist, then you can get in touch with kind of the regional team. So if you email the EHCH team, we can put you in touch. But there's a lot of work, as Bryony was saying at the beginning, around improving that support for oral health, and some of that redesign of that domiciliary visiting is part of that work. So we know that there's gaps at the moment, but we need to have them highlighted so that we can actually kind of like raise those as concerns.
Brilliant. Thank you, Jane. That's great. Next question was from Fiona Sadat. When are GPs, or when are GPs arranging flu vaccines for care homes? Can anyone pick that up? Is that too broad to answer as a simple answer?
Well, they should be doing it now. This is Catherine speaking, because the flu vaccination season has started. And you know, there is a remit around PCNs, primary care networks, to look after the care homes in their patch. I can pick up, it's certainly been in the CCG plans, but I can pick up within my team where we are with that. But if you haven't had anyone in touch with you, by all means, let us know so we can find out what's going on. But the flu vaccination season has started. So they should be certainly coming out and vaccinating residents.
Brilliant, thank you, Catherine. As I say, do get in touch if that isn't the case. It'd be interesting to take that forward. Next question was another one from Maxine. Are care home GPs being instructed to offer vaccinations to staff as well, presuming as well as residents? Normally it's only if they want to do so, but it would make better sense if GPs could be instructed to. I think, did we pick this up later in the presentation? Is there a kind of one rule on that?
Well, there's difficulties around, because GPs can go in and vaccinate, you know, residents. But of course, if you're a staff in a care home and a GP comes in to vaccinate you, it's not your GP. And we did have this discussion around because the GP who gives you the vaccine would have to be paid for the administration, but then your registered GP is not paid, and the information is get across, and it's all very complicated. So we have been looking to see if, because pharmacists can go in and vaccinate everybody on the spot and then send the information across. Not every pharmacist has the capacity to go in and do that because they have to backfill their job. So we were looking at, could GPs do that, but it's very complicated in that the GP would be vaccinating somebody who's not a registered patient at their practice. So we are looking at it, but it is this sort of mirrored, you know, this kind of bird's nest in a way of things that we're working through. So sorry, I don't have a better answer than that.
No, that's okay. Thank you, Catherine. Next question was from Philip Mobin. He's saying that we're finding it difficult to obtain the anaphylaxis training for our nurses. Is there an online training available? Is there online training available? I think is what Philip's asking.
I'll answer this again, Catherine, unless somebody else has a better answer. You're not the first person to have asked that of me today, actually. There isn't, as far as I know, online training. The preference is, of course, to have it face to face because you need to practice on dummies, etc. Emma Collins, who leads on immunisation training on my team, she has raised this with PHE National to see if they've got a solution. She hasn't heard back from them yet, but you're about the third person today to have asked me, so we are looking into that.
Catherine, it might be interesting to catch up with the Nottingham team because they do this on a regular basis. So this isn't their first year that they've been training their social care teams. I have the contact details, so we can look into that and see if we can steal something and share with Pride.
That would be brilliant. Thank you.
Excellent. Thanks, guys. Next question was from Richard Elphick. Thank you, Richard. It's asking, how easy is it for staff to access tests? And is it easy to track take-up from social care staff? We're talking about flu tests there, of course. Again, I'm putting this to the panel generally. I'm not sure how easy that is to perhaps find an answer to. this one
Catherine, I don't know if you had any thoughts on that. There's multiple access points for staff.
Bryony, we've got Sam on the call, so
wonderful.
Sam might be able to help answer that.
Thanks, Ezra. Hello,
Thank
sorry
you,
I'm
Sam.
late. It's Sam Perkins. I'm the regional flu lead for PHE in London. I'm sorry I couldn't join from the beginning. Just to say, routine testing for flu for anybody is going to be difficult. It's not something we would routinely do, but within our winter preparedness plans, certainly Ezra will have spoken about the London SOP for outbreaks for care homes, and there's a general principle this winter. Any outbreaks of acute respiratory infection in care homes, we will treat on the basis of COVID from the beginning. So we will be offering infection prevention control guidance around COVID and appropriate testing for that through Pillar 1 if it is deemed to be a new outbreak. We will also do a limited number of tests for flu and other acute respiratory viruses as well simultaneously to that, because we really do need to establish whether it's flu, COVID or something else. And if it were identified that this was a flu outbreak, then we would be working with the CCG to get antivirals in quickly. So that would apply to staff as well. So we're not quite taking the same blanket approach to testing for flu, but we will have some sort of targeted testing going on to establish whether the flu is causing the outbreak, and if so, we can then respond appropriately across the home. Thank you.
Thanks, Sam. That's really helpful. I think the next question might fall into a similar bracket. There's another question from Vicky, and who's just coming back into the lobby. Another question from Vicky in NHS South West London. So, are we able to get feedback on the numbers of staff in care homes who get immunised? In the past, social care sectors have not been separated, so we don't know. Also, can commissioners find out care homes who are taking it up for staff and those who are not, so they can work with those who aren't? Anyone who could pick that up for us at all?
So it's Bryony, so I can pick up some of those issues. So absolutely right, Vicky. As we know, it's been very difficult to track in terms of uptake previously. So I've put in the chat, but Capacity Tracker is adding particular questions relating to flu uptake for care home managers to complete, which includes the number of all your residents that have had a flu jab, yes, no, and don't know, but also the number of your staff who've had a flu jab, yes, no, and don't know, which I think is going to be great in terms of every provider is accessing Capacity Tracker in order to put the information in, and will allow us to extract that data and look at it.
Hello, speaker speaking.
And by provider.
Hi, Dylan.
Sorry, can we just ask all the delegates to go on mute?
Okay. Did they give you a form today at school about your?
There we go.
Becky, you're not on
but
mute,
obviously it's not without its challenges, because it's dependent on self-reporting, and it also is dependent on every provider completing it. But as a starter for 10, Capacity Tracker will include those questions going forward. We expect from the beginning of October rather.
Brilliant, thank you, Brian. And I think that answers questions we had from Trudy Reeve and from Brian Roberts as well in the chat. Another question from Maxine that came in. I think it's more of a statement or an observation, but good to go through it. So Maxine is saying that it's just piecemeal intel at local level until providers have to report to central government on flu uptake from staff. Until that point, we will not get the uptake required. And she's mentioning that in Greenwich, they tried all different incentives, including £100 gift vouchers, but most homes only ever got to about 80%. So again, it's probably an expression of a statement of interest, of opinion more than anything else. Unless anyone wanted to particularly pick up on that, I guess there's no silver bullet.
Sam, you've got your hand up.
You're on mute, Sam.
Sorry, that was an old hand. I apologise.
Oh, okay. So that was a hand in there.
This is Catherine coming in.
Okay.
What we could apply is what we did with the healthcare workers and trusts. So we used a Delphi method study about a year and a half ago to find out, because there was so much in the literature on why healthcare workers wouldn't take up the vaccine, but very little in what works. So we used the Delphi methods to put together what works. We put together 7 steps to success, it's called. We implemented it and uptake went up to 69%, and we evaluated throughout the year, and we're applying it now to primary care. We could apply the same thing to care homes to try and get it. It's the steps work, and so we can apply it across, but incentives tend not to actually. Or you think it might, but actually it does for the first year, and then it sort of peters out after that. The problem with care homes is that there's never really been any scrutiny of their flu vaccination uptake in care homes. There's never been any real sort of push, but this year there is. So actually I'm hopeful that this year we start getting things off the ground that can be embedded for future, but we can certainly share those 7 steps of success.
Brilliant.
But it does boil down to, you do need to have somebody who's going to take responsibility on the ground and who can link in and use a similar system that what we use for the trusts like SITREPs, etc.
Excellent, thanks, Catherine. I think the next question we had was Vicky again. It was an IT question, but if I commit Vicky to asking the team to have a look at that with an Internet Explorer and other kind of tech barriers. The conversation then went on to kind of PPE. There's quite a few questions here. Now I'm aware that we've only got 4 minutes left, but I think it might be worth us going through a few of these. So I'll read out a couple. First, from Mick Jones. Mick was stating that PPE is not going to be free. The portal is explicit that it is only for emergencies. Trudy Reeve was then asking, will hospices also get access to free PPE? And then Vicky came in again to ask, is PPE for ongoing provision or just if short supplies? So does anyone want to kind of come back on some of those PPE questions about, first of all, whether it's free or whether it's only for emergencies? Then perhaps the hospice question.
So I think we need to go back and do a bit of digging. So if everybody's kind of like prepared to let us just have a little bit of time, obviously that information came out on Friday. I think, Mick, you've probably spotted something that I hadn't spotted as yet. Going down into that a little bit more detail, but I think it's a bit naive of me to say we know the answer to that one, but we will come back to you.
That's great. And I suppose, Jane, we could also check on things like hospices and the other kind of questions around that as well and come back to those and share it with delegates.
I believe they can get on the portal, but I just need to kind of like, again, clarify that one.
Okay, marvellous stuff. Okay, more questions on PPE. And then another question about capacity tracker from Paolo. Thank you for that. I think we've covered that one off. Some questions there maybe for Alice around NHS mail. Question from Maxine. Does the NHS email have to be from person specific, or could a care? Sorry, I'm going to start that again. Sorry. Does the NHS email have to be person specific, or could it be a home, or could a home have a care home name? And I think what we're asking there is, does it have to be person specific, or can it be a generic email address? Would we know an answer to that?
Yeah, so when a care home signs up for NHS mail, they're all set up with a personal one, but they are then all attached to a shared mailbox for the home. So we're also advising to use that shared mailbox so no information gets lost. And we can set up to 10 individuals from each care home up with their own NHS mail account, which is then linked to a shared email account for the home.
Brilliant, thanks, Alice. That's really helpful. Question from Trudy Reeve, who's asking, who holds the updated list of the care home generic nhs.net email addresses? Would we know the answer to that?
Yeah. So I'm going to jump on that one just because we have to sort of manage resources. So we can get this for you. It's not easy. It does need our team to do some manual kind of like dig in to be able to get those email addresses out. So if you have got a request for that, can you email me, so jane.sprout@nhs.net, and we'll agree a timely manner that we can get that across to you. But yes, we can do that, and that's where Hillingdon have been using it for their meds optimization. And actually, I've just replied to Trudy to say Andrew Gage at BHR wanted to use it for their end of life care, their fast track patients. So actually, yes, there's some really good examples as to how you can use that data really proactively.
Thanks ever so much, Jane. Next question's coming in from Alexandra Kalmis. We're talking now about the PCN care home DES. So the question then is there more detailed guidance coming regarding what should be payable out of the PCN care home DES? Is this just to cover the GP clinical time, or partner organisations also? Any one of the panellists pick that up at all?
James, I think we will take this on our way and ask our PCN colleagues to have a proper answer to this.
Great, thank you, Ezra. And there's a follow-up question from Katrina Davis. Again, I thought the DES had been amended to state that the clinical lead didn't have to be a GP, but that might be another one that we want to double check on that.
I can confirm that it definitely can include GP, nurse, or an AHP. So yeah, that did get changed.
Great, thank you. Rattling through them here.
And I think, James, we're out of time.
Out of time. Okay, well, shall I hand back to you to do closing remarks, Bryony?
It feels wrong to close the discussion when there's so many great questions in the chat, but I'm sure people have also got to get off. Huge thanks to all of my colleagues who've presented, and James and the comms team for facilitating, and thank you very much for how interactive you've been. Just a reminder, we'll share all of the slides with you. We'll pick up those 3 specific questions. I think there were around PPE, and there was, I've already forgotten, but I have written them down. We'll find out the answers to those and send them out with the links. There is a second one of these webinars for commissioners specifically on the 12th of October. So if you have colleagues who you feel would benefit from that, let us know and they can sign up, or if you want to do it all over again. And if there's been any new guidance that's come down as a result of second wave planning, etc., we'll make sure that's represented in the updated presentation on the 12th of October. And a reminder, there's a providers focus webinar on Wednesday. So again, please let your providers know to join that. But I think I'm going to bring us to a close unless anyone wants to say anything else from the panel. But no, so I think thank you ever so much. Have a great rest of the afternoon, and potentially see people again on the 12th. Thank you very much.